All right, welcome to the foam rolling portion of Mobility Flow. We recommend that you use the foam rolling technique before you do joint by joint mobility and stretching, okay? So this is a great prepper, gets the blood flow, prepares the tissue for movement. It's like a self-massage. So you can get a foam roller just about anywhere these days. Doesn't have to be this big. You can get a smaller one so it can fit in your luggage. That way you can use it for travel. For this video, we have a long one. We're gonna start on our back. Get that upper back tissue. So I'm right underneath the shoulder blades. I wanna hug your body, lift your hips off the ground, and I'm gonna use my legs to help propel me over the foam roller. So really hug yourself, open up that thoracic spine. I'm not on my neck, but I'm really rolling out the upper portion of my back without rolling on my cervical or neck vertebra. I don't want you up there. We're using a wider area, a lot more muscle, a lot more protection, and we're getting that upper back portion, all right? So from here, let's get some extension. We all need a little bit more thoracic extension here. So I'm trying to keep my rib cage down as I extend backwards, and I'm hitting different portions, rolling up and down as I extend backwards without or being aware of lifting that chest up. So try to keep your ribs down as you go into extension, okay? Now I'm gonna go ahead and roll over on my armpit on the right side. So from here, I'm kind of in, not directly in my armpit yet, but I'm right on the rib cage area here, and I'm going palm down, palm up. Use some common sense. You should be in a little discomfort, not necessarily in pain. We're not seeking pain, but we are seeking a little bit of discomfort. So from here, I'm gonna roll on my front of my shoulder, palm down. We all need more pec. This is the anterior portion of the shoulder and pec area. Ladies, be aware of sensitive areas. And we're gonna kind of roll in and out, palm up, palm down. Okay, now I'm gonna roll down a little further, or you can lift up and manually move the foam roller into the armpit area. So this is where it gets a little nasty. You can get in that lat area. We all get really restricted in here. So don't be afraid to kind of hang out here, go fishing, breathe through it. If you find a really tender or sensitive area, you can kind of just hang out here and just breathe through it. Try to melt into it. So I'm just kind of going different areas. I'm fishing around for some discomfort and sensitive areas as I roll up and down. So really no rules on this, as long as you're not moving into pain or any type of shooting nerve pain or anything like that. So for the purpose of this video, I'm just gonna do my right side, okay? So you'll know when you finish the right side here, you'll roll over and do the left side. Spend some time on these areas where we need more work, and that's the front of the body. All right, let's go ahead and go down. Now I'm gonna face this way, and I'm gonna stay on the right side of my body. I'm going to the left quadricep, all right? Okay, I'm gonna lay right on top of this. I'm right above my knee, and I'm gonna use my left leg and my arm to help propel me over top of the foam roller. Remember, we're really tight on the front side of the body because we sit at a desk. A lot of people are sitting at desks for prolonged periods of time, and we're sitting in traffic, so the quads and the pecs and the abdominals and the neck flexors, they all get really short and tight and can cause all types of problems. So right now I'm moving up and down, right above the knee, all the way towards the hip. And I'm just kind of going fishing. I'm looking for some discomfort. I'm looking for some dysfunction a little bit. Wherever you find a little bit of discomfort, Don't be afraid to move in and out of it. Hang out there a little bit. And I'm changing angles, changing positions, so I can hit different areas of the quadricep. Okay? Okay, from here, I'm going to go into the inner thigh. So I'm going to turn this foam roller vertical. I'm staying on the right side here. I just got done with the front part of the leg. Now I'm on the inner thigh here, the adductors. Okay, and I'm using, once again, my arms to roll in and out of that inner thigh. This can be a very sensitive area, so be careful with how much pressure you allow to go on the tissue of the inner thigh. But I'm going to go all the way in, nice and deep. Play around in here, see what you can find. Most people never go in here, so this can be really sensitive, like I said. All right, so now from here, I'm going to go ahead and go to my glute. So I'm going to sit on this on the right side. I'm going to pull the right the right ankle over top of the left knee, just like so. And I'm going to use my left leg and my right arm here to roll on the outside portion of my glute. So I'm changing angles. Don't be afraid to change positions. I'm looking around. I'm going fishing for some tightness, looking for some discomfort. If you find an area that's really sensitive, then hang out there for a moment. Okay? There I am changing some angles. I'm using different pressure. Okay, you can use different tempo, how fast you roll over the tissue. But I'm using my right arm, my left leg here to go over top of that glute on the lateral portion and the back portion of that glute. So we just finished the right side. Now it's your job to do the same exact thing on the left side so we can get a full body, soft tissue routine. And remember, try to perform this before you do your joint by joint mobility and your stretching. It'll just give you more availability, all right, when you do stretch and when you do your mobility, okay? It'll warm the body up and it kind of preps the body for everything that's to come, all right? So we'll see you on the mobility section coming right up.